What if I told you that vaping every single day for just 30 days could completely change the way you feel and how your body functions? It might seem harmless, right? After all, vaping is marketed as a safer alternative to smoking. But the reality is that vaping can have profound and often surprising effects on your body, even over just a month. The truth is, the consequences may be more serious than you think. So, what happens to your body after you vape every day for 30 days? Well, let's dive into it. You might start off thinking vaping is just a fun way to unwind, or maybe it's just a habit you're trying out. But within just a few days of vaping every day, your body begins to adapt to it, and not in a good way. While vaping doesn't expose you to the same level of tar as smoking cigarettes, the chemicals in the vapor can still have a significant impact on your lungs. After only 30 days, you could start experiencing the early signs of lung irritation, coughing, wheezing, shortness of breath, and even chest tightness. These aren't just temporary symptoms either. Studies have shown that daily vaping can lead to chronic respiratory issues, including bronchitis and inflammation in the lungs. Even more concerning is the long-term damage it can cause, particularly to your lung capacity. But it's not just your lungs that suffer from vaping. Your cardiovascular health can also take a hit. Nicotine, the primary addictive substance in vapes, increases your heart rate and blood pressure. These effects are not only temporary. Over time, daily exposure to nicotine can strain your heart, leading to an increased risk of heart disease, stroke, and other cardiovascular issues. After 30 days of vaping every day, your cardiovascular system is under constant stress, which could lead to long-term consequences. Even if you're not feeling the immediate effects, your heart is working harder than it should. And while vaping is often seen as a way to relax or reduce stress, daily use can actually lead to anxiety and mood swings. You see, nicotine stimulates your brain's pleasure center, releasing dopamine, the feel-good hormone. But over time, your brain gets used to this dopamine release, and it starts relying on nicotine to feel normal. This is where the problem starts. As you continue to vape every day, your brain becomes addicted to nicotine, and you may find yourself experiencing more anxiety, irritability, and even depressive symptoms. Even more worrying is how vaping can affect your cognitive function. Studies have shown that nicotine can impair memory and learning ability. While you may initially feel more focused or alert after vaping, the long-term effects on your brain could be detrimental. Daily vaping can lead to memory loss, difficulty concentrating, and even a decrease in IQ over time. After 30 days of vaping, you might start noticing that your mental clarity isn't what it used to be. This mental fog can affect everything from your work performance to your ability to stay focused during everyday tasks. But that's not the only thing. Your skin also starts showing the signs of vaping. When you inhale the chemicals in vape juice, your skin can become dehydrated, leading to dullness, dryness, and even premature aging. The toxins in the vapor can damage the collagen and elastin in your skin, which are essential for maintaining a youthful appearance. So, after 30 days of vaping every day, you may notice fine lines and wrinkles starting to form sooner than expected. The longer you vape, the more likely you are to experience accelerated skin aging and a less vibrant complexion. Now, let's dive deeper into how vaping affects your immune system. You might think that vaping is less harmful than smoking, but daily vaping still takes a toll on your body's ability to fight off infections. The chemicals in the vape liquid, including formaldehyde and acrolein, can weaken your immune response, leaving you more susceptible to colds, respiratory infections, and even pneumonia. Studies have shown that regular exposure to these chemicals compromises the function of your immune cells, making it harder for your body to defend itself. After 30 days of vaping every day, you might notice that you catch colds more easily, or that it takes longer for your body to recover from illnesses. And it's not just the general immune system that suffers. Vaping also has a negative effect on your oral health. While smoking is well known for causing damage to teeth and gums, vaping can do similar damage. The high temperatures of the vapor can dry out your mouth, reducing saliva production. Saliva is essential for neutralizing acids and protecting your teeth from decay. Without enough saliva, your risk of tooth decay, gum disease, and bad breath increases. Studies have also found that the chemicals in vape liquids can irritate the gums and lead to inflammation, making your oral health worse over time. After just 30 days of daily vaping, you may start to notice your gums bleeding more often, or your breath becoming less fresh. Beyond the physical effects, vaping can also have a significant impact on your mental health. While you may initially feel more relaxed after vaping, the reality is that daily use can lead to a cycle of dependence. As your brain becomes accustomed to the dopamine release from nicotine, you may find yourself reaching for the vape more often just to feel normal. This cycle can increase feelings of stress, anxiety, and depression, making it harder to manage emotions without the aid of nicotine. For many people, vaping becomes a way to cope with stress, but in reality, it may be making things worse. And what about your sleep? Nicotine is a stimulant, and just like with coffee or energy drinks, vaping can interfere with your sleep cycle. While it may help you stay awake during the day, vaping before bed can cause insomnia and restless nights. Studies have shown that nicotine can disrupt REM sleep, the stage of sleep that's crucial for memory consolidation, mental restoration, and overall well-being. If you're vaping every day, you're likely not getting the deep, restful sleep you need to feel fully rested and rejuvenated. After 30 days of vaping, you may find yourself waking up more tired than when you went to bed, which can affect your productivity, mood, and mental clarity during the day. Another long-term effect of daily vaping is the toll it takes on your lungs and breathing. While many people believe that vaping is less harmful than smoking, the truth is that the chemicals in vape liquid can still cause significant damage to the lungs. Vaping has been linked to conditions like vaping-associated lung injury, VALI, a severe condition that causes lung inflammation and can lead to respiratory failure. Even without these extreme cases, daily vaping can cause chronic inflammation and decrease lung function over time. After 30 days of vaping every day, your lungs are working harder to clear out the toxins, and you may start to experience more shortness of breath, coughing, and wheezing. Let's also talk about the long-term risks. While the effects of vaping after 30 days are significant, the consequences of long-term daily vaping are even more concerning. Studies are still ongoing, but the evidence is growing that vaping can contribute to serious respiratory issues, heart disease, and even cancer over time. The chemicals found in vape liquids, such as formaldehyde, acrolein, and acetaldehyde, are carcinogens that can lead to the development of cancer in the lungs and throat. Just like smoking, vaping exposes your body to harmful chemicals that can increase the risk of developing life-threatening conditions. The more you vape, the higher the risk of these long-term health issues. So, after 30 days of vaping every day, what's the final verdict? You've built a tolerance to nicotine, which means your body is becoming increasingly dependent on it. You've experienced cognitive slowdown, including memory issues and difficulty concentrating. Your lungs have been irritated, and your breathing capacity has likely diminished, leaving you more vulnerable to respiratory conditions. Your heart has been under constant strain, and your immune system has weakened, making it harder for your body to fight off infections. You've likely noticed deteriorating oral health, with issues like dry mouth, bad breath, and potential gum inflammation. Your mood has been affected, and you may be dealing with increased anxiety and stress due to your dependence on nicotine. And most importantly, your body has been exposed to a cocktail of chemicals that increase your risk of long-term diseases like cancer, heart disease, and respiratory failure. But here's the important thing. It's never too late to stop. Quitting vaping, even after 30 days of daily use, can lead to rapid improvements in your health. Within just a few days of quitting, your heart rate and blood pressure begin to stabilize. Your lungs will begin to clear out the toxins and improve their function. Your immune system will strengthen, making you less susceptible to infections. Mentally, you'll start to feel sharper as the fog clears, and your sleep quality will improve. The earlier you quit, the quicker your body will begin to heal. If you're ready to stop vaping, now is the best time to take control of your health. It won't be easy, but the benefits are worth it. Drop a no smoking in the comments if you're committed to quitting, and let me know what's motivating you to make this change. Don't forget to like, subscribe, and share this video with anyone who could benefit from understanding the real effects of vaping. Remember, your health is your most valuable asset. Take the step to protect it today. Your body and mind will thank you in the long run.